Welcome to Tocilizumab Chronicles Beyond the Cytokine Storm, where we explore the intricacies of tocilizumab and its role in medicine. I'm your host, Dr. Shikha Agrawal, and once again we are joined by Prachi Virat, our microbiology enthusiast. Welcome to the show, Prachi. Let's dig into today's episode: Personalizing tocilizumab treatment, biomarkers, and patient selection.
It's great to be back, Dr. Shikha. Thanks for having me again.
Let's discuss biomarkers and patient selection for tocilizumab treatment. Are there specific biomarkers that can help identify patients most likely to benefit from tocilizumab?
Great question. In both RA and COVID 19, certain biomarkers can indeed help predict which patient might respond better to tocilizumab. For RA, elevated levels of interleukin 6 and C-reactive protein CRP are associated with active disease and many indicates a better response to IL-6 receptor blockade. In COVID-19, high level of IL-6 and CRP have been linked to severe diseases, and patients with these elevated markers have shown improved outcome with tocilizumab treatment.
How do these biomarkers influence clinical decision making in treatment planning?
These biomarkers are crucial in guiding treatment decision. In RA, measuring IL-6 and CRP levels can help determine disease activity and the potential benefits of tocilizumab. In COVID-19, elevated IL-6 and CRP levels can identify patient at risk of cytokine storm, where tocilizumab may mitigate the hyperinflammatory response. Monitoring these biomarkers before and after treatment can also help assess efficacy and guiding ongoing management.
So, what patient characteristics are associated with a better response to tocilizumab?
In rheumatoid arthritis, patients with higher baseline IL-6 levels and those who haven't responded to other DMARDs may experience better outcomes with tocilizumab. Additionally, certain genetic markers like polymorphism in IL-6 R gene have been associated with improved responses. In COVID-19, patients with elevated inflammatory markers such as IL-6 and CRP and those requiring oxygen support but not yet on mechanical ventilation tend to benefit more from tocilizumab therapy.
Are there any challenges or limitations to using biomarkers for patient selection?
Yes, there are several challenges. First, IL-6 level can fluctuate and may not always correlate directly with disease severity. Also, after tocilizumab administration, IL-6 level can paradoxically increase due to receptor blockade, making interruption tricky. In RA, while IL-6 and CRP are helpful, they are not exclusively indicators of disease activity, and other factors might be considered. Moreover, access to timely and accurate biomarker testing can be limited in some settings, affecting decision making.
Thank you for those insights. Before we wrap up, what's the key takeaway regarding biomarkers and patient selection for tocilizumab?
Thank you for having me, Dr. Shikha. The key takeaway is that while biomarkers in like IL-6 and CRP are valuable tools in identifying patients who may benefit from tocilizumab, they should be used in conjunction with clinical judgment and other diagnostic information. Personalized treatment plan that consider both biomarker level and individual patient characteristic can optimize outcome in both RA and COVID-19.
A big thank you to our listeners. Your support keeps us going. Follow the podcast and spread the word if you enjoyed the episode. Until next time, stay curious.